We did it at our university. We did a pretty elaborate test where we looked at Scotch Bond Universal, and at the time I didn't know the name, so it was our experimental bonding agent. We compared it to one of your existing self-etching products. We compared it to competitors' self-etch products. We compared it to Total Etch, and our purpose was to take your product and then use it as a selective etch. So we got etch on enamel. We also put etch on dentin. And the purpose was to see if there would be any adverse effect of putting etch on dentin. And again, we found that it bonded very well. It was as good or better than most of the other products we tested, which was a pleasant surprise. And I go into these pretty open-minded. So we were pleased with the results. At first, we weren't quite clear why you were doing this type of a study. And then it became relatively clear, having the option to do an etch or not etch with a self-etching system based on the enamel issues that have been around for a while. I think it was a pretty smart idea. I'll say there are a lot of good adhesives out there. I think that as a self-etching product, whether you use it with Total Etch or not, it's a good product. And you've got other good products as well. So compared to other products, I think it's a good product. I think that the ability to go to a dentist who says, I'm a Total Etch dentist, but wants the benefits of less sensitivity, wants the benefit of being able to say, well, I sealed the dentin, but you know what, now I'm safe. I've also etched the enamel. I think it's probably one of the better products that we've worked with. So, and there are other good ones, but it's one of the better ones. You know, it's a simple idea, but in essence, a brilliant idea. You've got parts of the world, not this country, but also this country, parts of the world that will not go to a self-etching product. You've got a lot of dentists, almost half in this country, have still chosen to go with a Total Etch. Now, I think they know why they're doing that. They don't trust the enamel etch of the self-etchers, but the dentin bond and the dentin seal and the sensitivity decrease is a big benefit. So if I could give them the best of both worlds, in those cases where they choose to, maybe in every case, it depends on the doctor. So I can use it self-etch, I can use it as in essence, a Total Etch, but get some of those benefits. I think it's a great idea. You know, your typical posterior composites, class 2s. I've done a number of class 5s with it, partly because on a class 5 I'll do it certainly as a selective etch. On the class 2s, I'm a Total Etch guy, so I will do a short 10-second give or take etch on my enamel, then use it as a self-etching product. I've only recently gotten the product. When it was an experimental, I wouldn't use it on patients in my practice, but I will now. I don't have any clinical data on the product, but the use and ease of use is something that'll make it popular. Now, I think at least the bench data shows it works. It's a product that seems to work. Again, I don't have clinical data, but at least it seems. I think it's an easy product to use. It's pretty simple. I think it's versatile. It gives me options. I'm putting in a non-retentive crown. I want to use Unisem. I can take your bonding product on a short crown. I can use it as a self-etch, use my cement, and get a very adhesive crown. I've actually done it. I did one case where I put a crown on a patient. It was an older patient. She had lost a crown, bonded it in. About 2 weeks later, she suddenly said, you know what, I want to redo that crown. It was a nightmare cutting that crown off, because not only of the bond to the tooth structure, but the bond to the old porcelain fused to metal crown. I was pretty much shocked at how hard it was for me to get that crown off. So then I started thinking there's even more options with this product. Well, like I said, cementation with a one-step cement, a self-etching, self-bonding resin cement is fine. There are some cases where, like that one, where I'm dealing with a non-retentive crown, a lost crown. This gives me an option. I can use your self-etching bonding agent. I can use it with your self-adhesive cement like Unisem, and it's going to give me a very fair amount of retention. I know the chemistry of that product, and that makes sense why that was the case. I mean, your chemistry allows for a very significant bond, not just to tooth structure, but to the metal. I've had no post-op sensitivity. I was not, and I used your Single Bond Plus for the longest time, and I use a fair amount of resin ionomer liners. I wasn't getting a lot of sensitivity, but I'm getting virtually no sensitivity at this point. Now again, it's a very limited sample size. I haven't done a lot with it, but from what I have used it for, it seems to be very good. I'm not sure it will change the way they practice. It might. I again think that for the dentists like me that are more conservative, that still believe in a Total Etch, it'll give them an option. I mean, they could always, in essence, do a selective etch. You know, your Easy Bond is a great product. So they could use that with a selective etch if they chose to, but I think given some of the new chemistry, the MDP that was added to this product, I think now you're getting the benefit of adhesion to other materials like metals, like micron, like zirconia. So it has a lot of opportunities. I don't need to condition a zirconia crown with a primer. I can use your product in this case. So it gives me options for veneers, for bonded restorations that I wouldn't have done with a self-etch before.